Okay, when to think about revision of some kind. And there's again, as I've been telling y'all here lately, there's a lot of really good research starting to help us think more clearly and more effectively about these topics. And one of the kind of medical weight loss gurus, research gurus that I follow, Dr. Kaplan, this is his way of organizing it, and I'm a big fan of it, at least at this juncture, is to kind of separate failure, if you will, into two categories: primary failure and secondary failure. Primary failure would be somebody who either didn't lose enough weight with their surgery, and that's our only criteria, or somebody who maybe lost not an insignificant amount of weight, but their comorbidities are still an issue. The best science supports that whatever surgery they had is inadequate, and we need to amp up the surgical intervention. So it would be like somebody who had a band, who did everything right, had a moderate amount of weight loss, but just not nearly adequate enough. They're going to need to think about taking the next step to a sleeve gastrectomy or a gastric bypass or whatever. And the same thing, sleeve to whatever else is going to come after that. So that's kind of solidly supported by research. The other area in primary weight loss failure is medications. And here's an interesting, again, your DNA is not rigid and fixed. People for whom Adipex or the other weight loss medications quit working right prior to their surgery, somehow the act of surgery alters the messaging, and that stuff might start working again. So somebody who's bumping along 6, 9 months out, whatever, and all of a sudden hits this hard plateau, thinking about adding medications is something that's really worthwhile and worth indulging, at least to test the theory. Now the other category, secondary failure, somebody who's got excellent results or at least good results and has maintained them for some period of time, 2, 3, 4, 5 years or more, but is now having significant weight regain issues. That's a stickier wicket, and there's not as much evidence to support that more surgery is obviously the answer right out of the box. That's something that we're going to have to sit down and talk individually and kind of get a sense of where you're at and work out a game plan. But for somebody to immediately think about another surgery is probably not the right answer for the overwhelming majority of folks in that situation.